Hi, I'm Heath McGowan. I'm one of the anatomy lecturing staff at Bundoora, and I endorse this clipboard product.
This is a presentation on the innervation and blood supply and drainage of the thigh. Looking at the blood supply of the thigh, there are 3 muscle compartments, which means we'd expect 3 nerves and 3 arteries. So looking at our anterior compartment, we have a femoral artery. So the femoral artery, thinking of the abdominal aorta travelling down at L4, bifurcates at the sacroiliac joint. It bifurcates again, giving us an internal and an external iliac artery. So the external iliac artery travels deep to the inguinal ligament, where it becomes the femoral artery. The femoral artery then travels down the adductor or subsartorial canal through the thigh until it reaches the adductor hiatus, which is a space between the adductor and hamstring parts of adductor magnus, where it terminates as the popliteal artery as it enters the popliteal fossa. You can see it going through that adductor hiatus in the posterior view. So termination doesn't mean that the artery stops or dies or ends. Sometimes it just means that it changes its name as it enters a new area. So the femoral artery supplies our anterior compartment, and it's assisted by the profunda femoris artery. Profunda femoris is the deep femoral artery. So the deep femoral artery supplies all 3 compartments. So the femoral artery contributes to our cruciate anastomosis and our genicular anastomosis, which are those branches of blood vessels where 2 or more blood vessels come together to form a network. Looking at our medial compartment of the thigh, we have the obturator artery. Now, once again, the abdominal aorta bifurcates into the left and right common iliac arteries. The common iliac artery bifurcates at the sacroiliac joint to an external iliac artery and an internal iliac artery. So the origin of the obturator artery is the internal iliac artery as it passes through that obturator foramen. It terminates in the medial compartment, which means it doesn't make it any further. It doesn't make it into the leg. It doesn't supply the leg. It supplies the medial compartment, and again, it's assisted by profunda femoris, that deep femoral artery, which supplies all 3. And it also supplies the head of the femur. Finally, the profunda femoris artery. That's our deep femoral artery. So the origin is the femoral artery in the femoral triangle. So the abdominal aorta has split into the left and right common iliac. The common iliac has split into the internal and external iliac arteries. The external iliac artery passes deep to the inguinal ligament where it becomes the femoral artery. Now, in the femoral triangle, just distal to the inguinal ligament, the femoral artery gives off a branch called the profunda femoris. It gives off all these perforating branches which supply all 3 compartments. The nerves of the thigh: in the anterior compartment we had the femoral nerve. As you'd expect, the femoral nerve is in the anterior compartment, just as the femoral artery and femoral vein are in the anterior compartment. So in this case, the posterior divisions of the ventral primary ramus of L2, L3, and L4 come together in the plexus. They pass deep to the inguinal ligament and travel down the anterior thigh. So the posterior divisions of L2 to 4. In the femoral triangle, it gives off its branches. So the muscular branch innervating that anterior compartment. Our cutaneous branch innervating the anteromedial thigh, the anterior knee. In the femoral triangle, it also gives off a branch called the saphenous nerve, which follows the femoral artery down the adductor canal and into the anteromedial leg. The vascular branch will innervate the femoral artery, with the articular branch innervating those joints, so the hip and the knee, the anterior hip and the anterior knee. Medially, we have the obturator nerve, formed from the anterior divisions of L2, 3 and 4. Anterior divisions, if you remember, if you scrunch up in a fetal position, anterior divisions innervate muscles which cause flexion, adduction and medial rotation. If we think about medial muscles, we're thinking about adductors. So the obturator nerve innervating all our adductors. So our muscular branch innervating our medial compartment. The cutaneous branch innervating the middle of the medial thigh. So that's the skin over the medial thigh. The vascular branch innervating that deep femoral artery or profunda femoris. And the articular branch innervating the hip and the knee. So those medial parts of the hip and knee. The final nerve in the thigh is the sciatic nerve. It is from L4, L5, S1, S2, and S3. This is made up of a tibial and a common peroneal division. So tibial nerve and the common peroneal nerve travel together. So this is made up of anterior divisions of our primary ventral rami, as well as posterior divisions, and they travel together as the sciatic nerve. They travel through the greater sciatic foramen and down the posterior thigh until they reach the popliteal fossa. In the posterior compartment, they innervate those posterior muscles, so we're talking mostly the tibial division, because its anterior divisions is going to innervate the knee flexors. Of course, the common peroneal nerve is innervating that short head of the biceps femoris. They don't innervate any skin, at least in the thigh. Vascular innervating parts of the deep femoral artery, and articular innervating the posterior knee. Deep venous drainage of the thigh. The venous drainage in limbs, for instance, follows the pattern of its arterial supply. So if we have an obturator artery, we'll have an obturator vein located in the same spot. A femoral artery will have a femoral vein accompanying it. Just be aware that the origin and termination of these vessels is opposite, because veins start distally. So our femoral vein, for instance, will have its origin as the popliteal vein going through that adductor hiatus. Its termination will be when it terminates as the external iliac vein, traveling proximally through that space under the inguinal ligament. We do have more frequent anastomoses, or branching between veins, and we often find that deep veins in the limbs are often paired. We call this vena comitantes, which just means accompanying veins, and they'll often sit either side of a deep artery. The only superficial venous drainage in the thigh is the great saphenous vein, which travels medially from the dorsum of the foot up the medial leg and travels along the medial thigh, draining into the femoral vein in the femoral triangle.